Hello to you all. This is Dr. Antoanela Garbacea with Prosthodontics and Implant Dentistry podcast. Welcome to our podcast today. Our guest of honor, Mr. Mark Witkowski. Welcome to our podcast.
Thank you so much.
It's a pleasure to have you here and discuss details, plus and minuses, your journey, dental journey with our office, and if you like to enlighten us previously, how was your life experience with dentistry?
Thank you so much, Dr. Garbacea, for inviting me for that
My pleasure.
conversation here. I'd like to share with your potential patients and my experience and my journey as I see it between the having normal anxiety, like I imagine most of the patients have anxiety from the dental procedures, to become an enthusiast of that offices and be a recipient of the fantastic restoration here, and arriving to the point when I call this my favorite medical spa, not just office. And I'd like to share some details historically how I arrived to that. I understand that's what you would like me to.
Thank you very much.
So please guide me through how would you like me to start about it?
Yeah, well, I understand that you had previously seen doctors with multiple crowns. You presented to us with a couple of implants and full restorations. There were some injuries in your past, and there were things that you were looking for. You were looking for fixed teeth, not dentures. You are looking for a complete rehabilitation, which we actually did for you. We provided and we treated you comprehensively, and you are wearing right now a full mouth rehabilitation on zirconia ceramic crowns.
That's exactly right. And so from the very beginning that I came here, my goal was to do the full mouth restoration because the injury in motorsports I was involved, and there was a lot of damage, but also I received some damage from some other offices that over years, my story with my tender age, I got a lot of historical experiences, which obviously for the time restraint I cannot share all of it, but I can only mention that I came 40 years ago from Poland, which at the time was socialistic. I received a socialistic type of health care, which with very bad results. So when I came to States, I met some dentists here in 80s, and they were very good, but they represented old school, so to speak, and they fixed my problems, and they lasted surprisingly for over 20 years. But then I get involved with the sports, I injure myself, and then I fell in under the hands of your colleagues who implemented some technology that are not parallel to today's, and that failed too. So I arrived some bad experiences, and in the process I went, my strategy was to do the good research, and I went to many consultations. I met a lot of your friends, and I was most of the time very disappointed for a variety of reasons, and I imagined a lot of patients, they have the same concerns. And when I arrived here, I was very pleasantly surprised that, first of all, you rendered the full analysis and during the consultation, and then offered to prepare the proper plan of that restoration. That caught my interest right off the bat. And so from that point, we proceeded.
Yeah. How extensive was your research, and what modalities and what different specific points were you interested to find the provider for your dental health?
Excellent question. That was really extensive. Geographically, I cover area from San Diego to Santa Barbara, from Santa Barbara to Palm Springs, Yucaipa, with stops in Loma Linda, prestigious area.
Right.
I encounter some of the good
Our
doctors
colleagues.
and calling themselves even professors by virtue of doing
Absolutely, yeah.
But anyway, when it came up to the point that during consultation I asked some probing questions that was of my interest, I never really get straightforward answers, unlike with you. You were very direct and presented that to me that you're very knowledgeable, that you know what you're talking about.
Thank you.
And there was some other aspect, maybe less scientific, that you presented that tremendous attitude and your impeccable bedside manners.
Thank you, Mark. Really appreciate this.
So
this is a beautiful description.
I was stricken by your charisma and by your kindness. And that kind of solidified my commitment to your office. And I came, and again, you prepared the plan, and we arrived at some point to that financial plan too, which was very interesting, that you offer not only options as far as solution for my mouth restoration, but you offer a variety of options, which I didn't really was that concerned about it, because I was going for the gold, whatever was the best that you had to offer. But
Whatever is easiest for our
I
patients.
imagine that some patients might, most of the patients, they got very strong concern about how much would it cost and this and that. And so.
And for how long is the process, and how many extensive, how extensive will be the whole process. And then that relates into the value, and it's the monetary aspect of the treatment. Yeah. Absolutely.
So my research was extensive, and unfortunately I came across a lot of people that I was very disappointed. So
tell us about this.
Well, some doctors, they behave not like a dentist professional. It's not like a prosthodontics professionals. They were like psychiatrists, and I didn't need that, because my wife is a psychiatrist.
Yes.
She's the one responsible for referring me here.
You
and she
to
was
our
referred
office.
by one of your colleagues.
She should have been here today. We missed her presence. I know she's working.
And so she was referred by one of her colleagues and your colleagues from Loma Linda University. So since I already met few of your friends from graduates of Loma Linda, and I wasn't that really enthusiastic about it, but I figured let's try it. Based on my wife, she got always a lucky hand. And sure, she did. So that's how I arrived here. And in the meantime, I came across some doctors who rely mostly their credentials on the prestige of their medical schools or diplomas. Right. And because I deal with doctors a lot, my wife and I, we were running a student exchange with Europe with the medical professionals.
Yes, you mentioned that to us in the very beginning.
So I came across all kind of situations when I saw the differences between doctors educated in Europe and how they interact here, and so I had different perspective, and from that perspective I was very critical of what I saw here, and as a patient I was kind of sensitive to this. And then when I came here, all these apprehensions disappear.
I'm very happy that we met your expectation, at least in the very beginning. Yeah. Well, thank you very much. What were the highlights of the process when you understood that there's going to be a staged process, couple of months, almost a year of treatment? What was your, how did you compare our treatment plan with different other treatment plans? I'm sure that nowadays there's a lot of, teeth in a day, and there's a lot of also short-term treatment where in 3 months you can have all your permanent crowns placed.
Yeah, my research included just watching advertisement on TV with the famous Clearview professionals, and I went to some of their offices to see how do they really operate, and then I went.
It's a much faster process. It's maybe more convenient for other patients, but everybody's different.
I found it from the patient perspective very deceptive advertisement, because they don't really they try to convince people that they can, with the magic wand, they can change your problems, health problems, and that's what I want to underscore here. That my first perception is that you practice art of medicine, as I call it.
Thank you.
And
we take our time. We respect biology. We respect every phase of the treatment. So it ended up being 9 months for you,
but
or so, approximately.
And that is so different between what I experienced within my research, that the doctors implemented different techniques, and there was a era where I had the veneers, or then crowns.
Yeah, there are many veneers
different
placed,
materials, and different approaches, and then despite that I paid whatever was appropriate at the time, that all these technologies failed. My technology took about 9 months here for me to do that full restoration. So it's not like they're showing on TV that they come to our office and you walk out of the office and you go for the ribs and Lucille's restaurant. No. Then after 9 months, just like almost delivering baby, and now it's been 6 months since we finished that final results, with charming smile.
You have a beautiful
smile. But I don't
smile.
care about it, because I'm not such a prima donna. What I care really about what you did to me as far as improving my health. That was the most important. And my health was not good. I already had a heart attack. I had a couple stents.
There were concerns.
I really
Serious
appreciate
concerns.
your approach. That was very serious. And within the concerns. I appreciate how you guided me prior to the full anesthesia, which, because my first original surgery was like 8 or 10 hours. I don't remember details because I was deeply asleep.
Full day. Yeah,
Full day
with general anesthesia.
And I was in your good hands. My wife was here in the foyer and she was supervising. My son, even who's a doctor, came to check out
the famous dermatologist.
Not only on you, but check out on anesthesiologist.
We met all your family, and that was delightful.
And my son does some surgery too, so
absolutely
he came to check if it's everything is up.
That was
great.
That was probably quite the most. I mean, maybe you felt fearful a little bit. There was a little bit of dental phobia. How did you overcome this large appointment? I mean, this is quite a full day where you don't have control because you're definitely going to be fully anesthetized, and you'll be spending the whole day in the no chair. Your whole family is going to be around. And how did you bypass, because you did a wonderful job. You came very apprehensive and of course worried. Can only imagine if even anybody will need an extensive surgical procedure. And then after that, things have changed and they were so easy. You went through the rest of the process very, very easy and very comfortable.
Well, before even surgery, you made sure to ease up my concerns. I didn't really have phobia, but I have some certain anxiety.
A little bit,
not only about dental procedure, but obviously about anesthesia with my history of my health. So then you were very good guiding me through the intricacies of that preparation for the surgery by recommending. I went to my cardiologist, they did stress tests, and they gave me green light for it. So I was kind of assured, so I figured that, well, Dr. Garbacea pre-qualified me for that procedure.
We were very happy
my
you received the clearance.
Was on board, and the anesthesiologist was very good because I kind of researched to his background. He gave me all his credentials, so I was kind of at ease. And I recall very vividly that when I came here, he was already here and the office was still closed, and he came up in his tiny Tesla and he brought a load of this equipment for the anesthesia. Yeah. But anyway, I woke up from that with any problem. That was another thing that really surprised me, that I was prepared to have some major discomfort and some pains, and I woke up with the provisional prosthodontics. Of course, I was a little bit dizzy and took me 24 hours to come to my senses. My wife, lucky for me, drove me home. I don't remember which way we went.
Yeah.
And so she claims that I acted like a backseat driver and guided her, but I don't remember anything. So I took your advice and I slept quite a bit to disperse all the chemicals. And then I follow all the procedures, taking care of the hygiene post-surgery. And there was major surprise. There was no discomfort because I attribute it to your magic hands.
No.
As a surgeon, and because I wasn't butchered, I didn't have major swelling. I didn't have any bruises. I'd like to take full credit of it that I'm such a fantastic...
You healed very well. You healed very well, and you presented very well in the first follow-up appointment. I was impressed, yeah.
So I would like to take full credit for it, but that's not right, because I give all credit to you as a surgeon. And I've seen few surgeons in action, and I had some surgeries prior, so I know how it could go bad or even... Anyway, I don't want to be too negative about it, but I want to give perspective why my perception of your art of medicine is so overwhelming for me, because I witnessed so many atrocities practicing the medical field so I had to take a lot of abuses. And ever since, I met you, this is my favorite spa, as I said.
Oh, thank you. You're welcome anytime. You are one of our beautiful, very well respected, wonderful patients. All our team are in love with you. They always happy to see you coming in, and I feel rewarded that you praise us so much, and I feel rewarded that your result it's been accomplishing all the goals you had in mind. I'm hoping that we made it kind of easy or easier than you expected for you.
Thank you for such a kind word, such a kind compliment for me. But since you mentioned your staff too, that I don't want to miss that opportunity to
Absolutely.
underscore
It's a team.
how great
It takes
team.
a team. Yeah.
That team is great. Of course, you're a leader of the team, but the ladies who are in administrative position here, and assistants, and your students who you're teaching. And also, I want to mention how great you were educating me as a patient. You share with me your lectures that you give to the serious
Well, you
professional
asked.
students.
You
Yes,
asked
I
me,
did,
yeah,
but
can I see your material? I said, I'll be very happy to show you, historically, where did we start it? And you probably saw a couple of slides, hundreds of slides with metal ceramics, which we don't do anymore, and titanium bars, and,
yeah, a couple of slides,
couple of-
1,300 pages of it on the PowerPoint. Took
That's
me
true.
a
That's
couple
a
nights
huge
to
PowerPoint.
study that, but that put me at ease
but
as well.
gave you
because-
a perspective of what to expect and
better
how,
understanding
yeah,
what's going
and better
on.
understanding, yeah. And I'm assuming that after that surgical procedure, things were a little bit easier, and then it was flowing as expected. And what was the nicest part in all this journey? What was the worst part? I assume that was the surgery. What was the nicest part that you were remembering?
It's really hard to point or nail down any particular nicest points, because all my experience was very nice, and so there was no really glitches here. And I had privilege to observe how you kind of evolve over that 9 months too, with improving your environment here.
Yeah.
Because I witnessed how you design and improve the practice and the setting here. And
There is no standing still. Yeah.
Well, you designed
like one of our mentors are saying. Yeah. Mm-hmm.
Very impressive operating room. And
we
all the tools that you were using on me, and I saw how they improved over that 9 months and following time.
Yeah.
And I was, as an engineering mind, because I'm an engineer by trade, then I was very impressed how you not only utilize the newest technology, the digital technology on the cutting edge of it, but how you skillfully operate it. Because you can give it fancy tools to some person or some doctor even, and they not necessarily know how to use it to its potential. And you impressed me mighty with that you flawlessly, and your patience, not only with me, because my perspective is that I'm your most obnoxious patient here, asking this and that and schmet, while you demonstrated to me how patiently, and I was impressed with that very much. So teach your students, and then
to take time with details and appreciate the team.
Inadvertently, I learn a lot just listening to.
I think we do educate our patients to an extent that they understand even the smile design, even major or minor details in design. And I have to give credit to our lab technicians. They are very experienced, and they participate, and then they want the best for the patient. Ultimately, that's our goal.
Mm-hmm. Mm-hmm. So
yeah, that became our.
I concur.
Yeah, I concur. Yes, thank you.
I tried to bring this elements of the little bit frivolous in our conversation, but
it's true. Technology. Yeah, because we have a lot of technology now, we were able to produce this type of prosthesis and produce the results with high accuracy, which I don't think that was possible 10 years ago. If I remember how we were making the metal ceramic crown, we were mounting the cats. We verify it here, there. There was quite a longer process rather than what we experience today and what we are able to do today with digital technology.
It's very true. And I had that privilege to witness all of it, how you operate here and meet all your staff, the engineering staff as well, those guys who work on the computers, designed it. And you were so kind to let me into the background, so to speak, or to your laboratory.
Of course.
That was very educational. But yet, for the viewers who'll be checking our interview, I would say that either they are interested in technology or intricacies of that, or some people just want to open the mouth and walk out with that beautiful smile and go and brag about it. This is the place to be, because from my extensive 40 years experience here in States, it's really hard to find that good places. I know there must be some doctors on your par somewhere in, I found some doctors in Las Vegas, but who wants to travel to Las Vegas from Southern California or somewhere up north? So as far as the Southern California goes, I met all these hotshots that my friends, because a lot of my friends that had some procedures, and they said, they were like, I got a good doctor, so okay, let me see. And I was never that impressed because the comprehensive care that you offer. Yes, some doctors
Appreciate
are
it.
very good dentists. Some of them very good surgeons. Some of them good prosthodontics or
Implantologist.
implantologists.
Mm-hmm.
But what's beauty of this of the office that you created that you have everything in one place. You don't have to. I don't have to be delegated in my previous experiences to separate offices to take the pictures, the imagery, or to do part of the procedure,
That's
or
true.
go shopping for implants in somewhere abroad or whatever, or tools. But you offer that as a comprehensive care, and that's really should put everybody at ease. They come and they encounter your wonderful stuff. They come, lay down on the luxurious chair, open slightly their mouth. I said slightly because with your golden hands, I was worried.
We
that
love you.
Talking about
Mark,
the anxiety,
thank
I
you
was
for the
worried that
compliments.
I had a friend who told me that he was under 6-hour surgery.
Sedation.
Sedation, but surgery, oral restoration, and the tools they use and
The
the
retractors.
way the retractors they use, that for a few days he suffered from pains and they kind of abused his mouth.
Discomfort, yeah.
Again, it could be credit to his anatomy or so, but I came out of the surgery
True.
in flying colors.
You looked very good and you healed very fast. We were impressed. Yeah, I think genetically probably you do have this tremendous ability to heal fast, and you did. Yeah, we see our patients struggling. It's everybody's different. Yeah, but I think that was one of the bonus to our process, that you responded very, very fair, actually more than fair, excellent response to the surgical procedures, and that was.
But for the people who might be having concerns and be having the anxieties, I can assure them that it's just those tiny golden hands of Dr. Garbacea as a surgeon.
Thank you. Yeah, it's
they
definitely
should
good
be
to have smaller hands. So surgeons with smaller hands are definitely have an easier access and manipulating and moving things around. It's definitely a bonus. Yeah. Yes, it
So
is.
that's what I love about it.
Thank you.
So the most, your skills that you demonstrated, of course.
After
your
25
attitude
years, yeah, I should be able to produce and to be able to deliver an excellent result to our patients. Yeah. And this was a wonderful description of your journey. What will be the message to our patient out there?
The main message will be that if you want to feel blessed and happy and lucky like I am now after that extensive time, that's
Sure.
important. They have to realize there is expectation have to be that it's not going to happen overnight.
Exactly.
I mean, initial prosthetics I received, those the temporary or whatever is proper term for it. Yes, they were helpful, but there is a time of recovery, and they have to be ready for it. But eventually, there is a light at the end of the tunnel, and that light is bright, but not as bright as your presence in the office here.
You're delightful.
Thank
you.
Your leadership is really, really nice, and so that's what I want people to understand. That if they are very sensitive and they had bad experiences, and if they have to forget about all of it, like I was able to forget about my bad experiences, this is the place to be.
Thank you. Thank you for your kind words. Thank you for appreciation and consideration to our office and our specialty, of course. And thank you for accepting to be here tonight and speaking about your journey. This has been beautiful that you shared with us how you found us, how was the process, and how you feel at the end of after everything has been done. So thank you, and thank you to your family, to your wife, and everybody that participated on this process. I know it was difficult sometimes, maybe to accommodate long appointments, but you really put it as priority. So I really thank you for this.
Thank you, Dr. Garbacea. Mostly, overall, thank you for the gift of health that I received from you.
Thank you as well.
After all the superlatives that I said, should I qualify that I'm not being paid for that interview?
You're not being paid for the interview. Lovely. Silly no.
Because as I said, I do everything to provoke your gorgeous smile. So sometimes I'm just making these silly statements which My wife will never allow me if she would be supervising that, but our director is so nice. He does a good job.
We love our patients, and we have really long relationship with our patients. They're happy to come and just say hello or bring flowers or bring chocolates like you always do.
I got a hint.
And I have to thank you for that every time you brought chocolates for our team members, and you were always smiling, and you were a wonderful presence in our office at any time. So I really have to thank you for that.
You're very kind. Very kind.
You
Thank you
too.
so much for all these compliments. But mostly, as I said, thank you for the gift of health. That's the most precious thing
My
I
most
received from
pleasure.
you.
I'm very happy I was able to.
Thank you.
Thank you. Thanks for everyone watching, and see you next time.